Welcome back. When you were little, maybe your mom, grandma told you to eat your carrots to keep your eyes healthy, right? Yeah, they wanted you to eat your vegetables, but what they were really doing is trying to plant that seed in you to take care of your eyes.
Yeah, there are some sight challenges that come along with aging, in addition to so many other wonderful things as we get older. Dr. Vance is a retina specialist at the Atlantic Eye Institute. She is new to Jacksonville. It's good to see you. Thanks for being here.
Thanks for having me.
Welcome. You say you come from the Orlando area?
Correct.
And so how long have you been in the bold city?
Since January.
Okay.
Nice.
It is nice. It's a great city, isn't it?
It's wonderful.
Welcome to the city. So let's talk,
Thank you.
you got the eye model there, and we're talking age-related macular degeneration.
Yes, age-related macular degeneration. Now that's the most common cause of blindness in people over the age of 60. Macular degeneration is damage to the retina. The retina lines the very back wall of the eye, and you can only see it when you get your eyes dilated at the doctor's office. Now the macula is the very center part of the retina, and so it's mostly responsible for our central vision. So to recognize faces or use the computer or read a book, you're using your macula. So you can imagine that any sort of damage to the macula can have a very significant impact on your life.
Yeah. An interesting statistic that you gave us here, 11 million people in the United States have some form of AMD, and that's going to double?
Yeah, that will double by the year 2040. So as our population ages, it's just going to become more prevalent.
Wow.
So, well, let's talk about it. I mean, what's causing this to happen? What are the issues there? I mean, is it just kind of going away? Like my sight's going away on the golf course, like I was telling you. I'm trying to help my game.
I don't know if she can help with that.
Are things people are doing that is causing it, or?
So that's a great question. So macular degeneration is a multifactorial disease, meaning there's several factors at play here. Genetics is definitely one of them. So if your mom or dad had macular degeneration, you may have an increased risk. Also, the older you get, over 60, the higher your chances of getting macular degeneration. And also women tend to get it more frequently, as well as Caucasian patients. So, you know, there are some things like you were alluding to with your last guest. There's just some things you just can't control, like genetics and your age and your race and your sex. But there are some things that you can control that can play a role in making this disease worse, and one of them is smoking. Smoking can double your risk of getting macular degeneration, and it can sometimes make the disease a lot more aggressive and resistant to treatment. The other thing is if you take some vitamins over the counter, they're called AREDS vitamins, they can decrease your risk of going from, you know, the early type of macular degeneration to the more severe type. They can decrease that risk by about 25 to 30%. And of course, getting, you know, annual dilated eye exams, especially if you have a family history of this disease, is a great way to catch the disease early and possibly get treatment early and keep your vision.
Man, if I hear one more doctor say smoking, 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 I mean, if you're smoking,
I've heard it long enough.
Right, every single time, it's one of the key things. Okay, so what are some of the treatments? Let's talk about that. But even beforehand, how does somebody at home know if they might be suffering from this? What are they seeing play out in their vision?
So early on, there might be no symptoms, but as the disease progresses, you can start getting waviness or distortion of your vision, especially when you're reading. And over time, as the disease progresses, you could see dark spots or black spots in your vision, and that could cause it, you know, make it really difficult for people to recognize faces or read or drive.
Oh, wow. Yeah.
All right, so I've heard a couple good things, though, because it's a little bit scary. Heard a couple good things. There is vitamins, things you can take, preventative, but there's also treatment, right?
Right.
If this does happen, you got a couple treatments.
Right. So, you know, there's two forms of macular degeneration, the dry form and the wet form. The dry form generally tends to be the less severe type, and we don't have a treatment for that, unfortunately. They're doing a lot of research in that field. But if it does develop into the wet form, when you start getting bleeding and fluid leakage in the back of the retina, there are treatments out there where it involves an injection into the eye. And I know that sounds awful, but those injections do not hurt, and they've saved a lot of people's vision over the last 10 years.
Yeah, I hate needles, but if it's a choice between not seeing and being able to see, I'll take the needle.
Absolutely. Yeah. And like I said, it doesn't hurt. It's painless.
Yeah.
Nice.
Okay. So best not to be afraid. Go in and see
Right.
someone who knows what they're talking about. And in the meantime, start what AREDS? Those are the name of the vitamins?
AREDS, A-R-E-D-S.
Okay, right there.
Regular
Good to
checkups.
see you. Thanks for being here.
Thank you so
And
much.
welcome to Jacksonville, by
Thank
the way.
you.
We're happy to have you.
And we want to thank Atlantic Eye Institute for making this segment possible. And for more information, visit atlanticeyeinstitute.com or call 904-241-7865.